From the Carl Chevrolet Studios in West Des Moines, welcome to Iowa Live. I am Lou, and time to check in with Dr. Josiah Fitzsimmons over at Owner-Vero Neuropathy. Hi, Dr. J.
Hey, Dr. Lou, how you doing, buddy?
I'm doing really well. Hey, we want to talk about neuropathy pain and some of the misconceptions that are out there. There are some people out there saying if you have neuropathy, you're just going to have to live with the pain. Here's some drugs. You could take those and cover up the pain. That's not the right answer. You have the right answer. This can be treated, can it?
Absolutely. In our office, we actually reverse neuropathy all the time. We have a 97% success rate. And so people always want to know, what can I do immediately? You know, in addition to coming into our office, the number one things we recommend outside of our office is eating a healthy, balanced diet. That's really the best place to start, especially if someone has diabetes-induced neuropathy. Managing their blood sugar is really important. Keeping that blood sugar in a consistent, acceptable range. Also exercising regularly, refraining from smoking, limiting alcohol, just paying attention to your hands and feet. If you do have any injuries that aren't healing properly, those are the bare basics that people need to do on a daily basis.
I did not expect you to say that. Is eating healthy is a way to treat neuropathy, but that is really key in what we're talking about here. And again, the underlying causes. But if somebody can't feel their feet and they want to be healthier, they're going to have trouble going out for walks, let alone doing any kind of jogging or anything like that, or any kind of exercise. What can they do about that?
Yeah. Well, first of all, I want to go back to what you just said, Lou. Now, eating healthy isn't going to reverse the neuropathy, but it may be able to help slow it down from progressing faster. Okay. And exercise is the exact same way. I know it's difficult, obviously, if you have trouble with balance issues or walking, but there's definitely different things that you can do on a daily basis, even if you have balance or walking issues. One of the most common things I recommend for people that anyone should be able to do is chair exercises. Even if you're unfortunately confined to a walker or a wheelchair, there's so many different exercises that you can do from the seated position to move your body, get active. Another great one as the weather starts to get nicer here in Iowa is getting out and going swimming. Really taking that pressure off your body with the water. Of course, as people start to get better, as they start to get improvement, we really want to start to get even more movement, blood flow throughout the body, start to get walking without pain. We have people that have seen huge improvements within just a few treatments at our office.
Now, you mentioned swimming, and swimming is such great exercise. And as you mentioned, the water will support your body and you'll have less pain, yet you are still working a bunch of muscle groups, aren't you?
Absolutely. That's the whole goal. With neuropathy, you got to improve the blood flow to get to those nerves. With the treatments that we do in our office, it's all about regenerating the nerves, increasing blood flow. And so our advanced technology is going to do most of the work, but anything you can do in assistance to get that results faster is just going to help you reach your goal at a quicker pace.
Now, tell us about some of the treatments that you guys offer.
So we do really unique treatments to actually heal the nerve pathways and restore the coating of your nerves. Our treatments actually work at the cellular level using low-level light therapy that's FDA cleared to actually help regenerate the nerves, decrease the pain, improve range of motion, mobility. But like I said, it's really, really important to get evaluated as soon as possible, because once someone gets over 80% nerve damage, sometimes they can't get full reversal. And neuropathy being a progressive degenerative condition, it just gets harder and harder and harder to do anything about the longer you wait. So number one thing is get in sooner rather than later, get all the tests done, see where you're at, and start taking action.
Yeah, that's the next step here. But you mentioned getting healthy and eating healthy. Some people don't do that. What about supplements? Do you recommend supplements?
Absolutely. What I always say is supplements can play a great role in the support of your nutritional diet overall. You really want to use supplements as a secondary add-on to eating a healthy, balanced diet. And so that's where we recommend a lot of supplements that are going to help decrease inflammation in the body. It's actually the number one cause of disease in the world is stress and inflammation. Those are the top causes, okay? And most people get inflammation from stress. So supplements are a great way to augment a healthy diet and then add on to the techniques that we're going to do in our office. All of our doctors specialize in neurologically based care. We have specialized equipment to regenerate the nerves, restore the arteries, and then we use the supplements to really add on and take this to the next level. In addition to you improving your diet, exercise, it's really a whole team approach to get you the best results possible.
All right, you are offering a $49 special. Tell us about that.
Yeah, absolutely. So huge discount offer we're doing with you guys for people to come in our office, get all those 8 unique neurological tests done, get a full examination by a doctor, see exactly what you have going on, and then give us the opportunity to evaluate that and come up with a whole game plan for you.
You are saving $200 on this, everybody. It's only $49 for this. Here's the number to call, 515-335-VERO. 515-335-VERO. V-E-R-O. Make an appointment and see one of the qualified doctors over at Vero Neuropathy and put an end to your neuropathy pain. Dr. Josiah Fitzsimmons of Vero Neuropathy, thank you as always, and we will talk to you next time, buddy.